No war has been won without somebody fighting the battle. Somebody fought the way for us to get where we are now, so I'm willing to fight the way for someone else later.
Across the country, RNs who work for the largest healthcare corporation in the world, HCA, have joined the NNOC to demand a voice for nurses and care based on patient need, not corporate profits.
We're all about patients and nurses, and HCA is about making profits. HCA does have a history of fraud. They're interested in buying facilities, making money, and then closing them down. All over the United States, we're doing actions to expose HCA.
This is just one story of how a small group of RNs in Tennessee are standing up to a healthcare giant to ensure quality care in their community.
I'm here because I would like to see Southern Hills reopen their labor and delivery so people don't have to go 12, 20 miles to a different hospital.
It begins in Nashville, where HCA Southern Hills has announced it will close labor and delivery services and move a much-needed neonatal intensive care unit to the more affluent Stonecrest Hospital 14 miles away.
We had heard that the labor and delivery was closing. In Southern Hills, there's the largest concentration of Latinos in the state. The wealthiest, most insured folks don't live in that community. We were involved because what HCA is doing is medical redlining. I'd been called by one of the NICU nurses. The NICU nurses wanted the NNOC to leaflet in the community because the labor and delivery had closed. The NICU wasn't admitting babies. The community had not, in fact, been notified. And they wanted us to try to help save babies from coming to that hospital.
Eric Álvarez investigó desde el hospital de Southern Hills.
The NNOC put up a billboard near the hospital, asked the community to call the CEO at Southern Hills. On Monday, we had a press conference to draw attention to that billboard. Southern Hills had a hearing to obtain a certificate of need to officially close the labor and delivery. Certificates of need were developed to prevent healthcare disparity and healthcare racism. During the hearing, Southern Hills stated to the state health agency that they had to close the labor and delivery because they were unable to locate any OBGYNs willing to come to Southern Hills and work. So the granting of the certificate of need was pretty much hinged on their testimony that they were unable to recruit physicians. We tried to refute some of what they were saying, but we didn't have any proof at that time. So the state granted Southern Hills the certificate of need to close the labor and delivery.
I am the medical director at the clinic, Médicos para la Familia. Dr. Rodney showed up with the newspaper and showed it to me. He says, well, hey, have you heard anything about this? And it was a story about how Southern Hills was closing. There were nurses who were picketing, trying to do something about it. I hadn't even heard about it. I need to call this and find out what's going on. And I called the reporter for the newspaper and said, can you get me in touch with these nurses so I can find out what we can do to help? That morning was the hearing that they had for OB, and I had missed it.
I got a phone call from a Dr. Martinez who had tracked me down and said, we have to do what we can to keep that labor and delivery from closing. We've been trying to get privileges to practice at that hospital for over 5 years. And I thought, did God ask you to call me?
Just to summarize the 5 years, the chief of OBGYN at that time basically told us not just no, but hell no. They didn't want any of our patients who were uninsured and it was going to bankrupt the hospital. All we wanted was to have privileges. We would accept the responsibility for those privileges. We were denied the opportunity to do that.
At the hearing, HCA said that the demographics of the community had changed and obstetric services were no longer necessary at Southern Hills.
The demographics of the patient populations are the same. we still see a lot of young people. We see a lot of patients who are pregnant, a lot of OB patients, a lot of working class. We got some little feet down here dancing on your bladder. I don't see how in just a few years that patient population has changed any.
Doctors from Médicos para la Familia joined NNOC nurses to testify at a second hearing to keep the neonatal intensive care unit open.
We had conclusive evidence. Dr. Martinez and Dr. Rodney testify that they had in fact applied for privileges at Southern Hills Hospital for at least the last 5 years, and the state health agency was astounded. They voted 5-4 not to allow HCA to transfer NICU beds to Stonecrest Hospital, and I burst into tears because I suddenly felt with everything in me what it feels like when you speak truth to power. And it was an amazing feeling, and all you could do was cry. Tears of joy.
Nurses continue to fight on behalf of patients in the Southern Hills area to ensure access to obstetric services, calling for hospital administrators to reopen labor and delivery. Their efforts have also summoned the attention of State Representative Sherry Jones.
I believe that the hospital misinformed the community when they decided to close the maternity ward. Misinformation to the state, but not even informing the community. I mean, HCA needs to be embarrassed about that, and I think that we need to go back and revisit that.
This incredible victory at the state level against HCA and their practices of putting profits over patients was done by just a small handful of nurses. And if we can attain that kind of victory with just a few nurses, think about what we can do if we stand together collectively. The sky's the limit.
Across the country, NNOCRNs are standing up to HCA, working to expose corporate lies detrimental to patients and communities as part of NNOC's larger vision to change healthcare for the good of everyone. Join us.
I would say to HCA nurses, keep fighting battles. It's the only way you're going to win a war.